Okay, my name is Robin. If you're following me, you probably know that already. The past 2 years, year and a half, 2 years, I've been having so many health problems that I've never had before, and it just make me miserable almost constantly. I have diagnosed mastocytosis, which is a mast cell activation disease, and it means that my body overproduces mast cells and histamine. And it causes me to be allergic or develop random allergic reactions to things that I've never been allergic to before. The very first time it happened to me was from the drug Bactrim. And I had a urinary tract infection, and I've had those before, and I know if I go to the doctor what they're going to give me for it. You know what I mean? I mean, we've all taken an antibiotic that was left over from the last time we had some antibiotics, or most people have done that. That's what I did. And automatically, it wasn't 10 minutes later, I looked over at Charlie, which is my fiance, and I was like, call 911. And I've never said those words to anybody. So he knew, something was wrong. He called. Before they even got here, I was laid out in my bathroom, barely able to function from an anaphylaxis reaction to Bactrim, a medicine I've taken a million times. A couple weeks later, I still had the urinary tract infection, and I had gone to one of the little clinics inside Kroger, and they gave me ciprofloxacin, or whatever it's called. And as soon as I took it, I immediately started and I took a nap, is what I did. I took the pill, and then I took a nap because I felt bad. And when I woke up, this whole side of my face was red and puffy and looked like it had bites all over it. Now, I'm a spaz about bugs in my house. I don't let people come in if I think you might have bed bugs, or you know what I mean. It's a phobia, I suppose. But that was my first thought was, oh my God, we have bed bugs. I tore my bed apart because I was like, that's what these are. I've seen these bites before. That's what it is. And that's not what it was. They just kept getting worse and kept getting worse. My eyes swelled closed. My lips were like this big. My top lip was so puffy it was keeping my nose from being able to draw in enough air. I went back to the little clinic and was like, what the fuck? You know what I mean? What is this? What's happening to me? And she pulled out this little chart, that they have, and it's got a body drawn on it. And they're supposed to take their little pen and circle everywhere that you have affected. And after circling for a few minutes, she just was like, circled the whole body. She said, I have never seen somebody with hives to this extent, and it wasn't making you not be able to breathe. Like, she's never seen somebody as covered as I was, and then it not affect my throat yet. But she epied me right there in the office, and then gave me a prescription for 3 more. And I had to use 1 more after it in order to, get everything to stop and go away. But I went to an immunologist after that, and he did some testing on me. My tryptase levels were high, and he said that that was an indicator of mast cell activation, mastocytosis. Well, since then, I've had reactions to a few medications. In office, they did a penicillin test, the penicillin test, and it's supposed to be a 4-hour test. It takes 4 hours to do this test, and they take this it looks like a little star punch, and they just kind of poke your arm with it. They don't even break the skin, it just kind of makes an indentation. And they do that with 5 or 6 ones, and I'm sure some of them are a placebo, and some of them are probably sugar water, and then one actually has the medicine in it, and it's to see, if you're going to react or not. And he even came in and told me that generally it takes 2 applications before someone starts to react. So he wasn't expecting any results from the little star punch. So he left me in the office, in the room by myself. He went out, he come back in about 20 minutes later, my arm was swollen. And he was like, "Have you touched it?" Like, "No, it hurts. I haven't touched it." So they went ahead and did the second part of the test, which was a scratch test. And before he even finished with all 8 of his samples, the first 2 were swollen. And he was like, "We're just going to mark this one as yes. And I'm not even comfortable finishing this test with you." So I have a very severe allergy to the Cillins, apparently. Macrobid did the same thing. Lexaquin did the same thing. I can't take any antibiotics. If I need an antibiotic, I have to be admitted into the hospital and desensitized first, and then monitored the whole time I'm on it. So I try to avoid that. In a year and a half, I've managed to keep myself from needing antibiotics. My main problem with that's going to be my teeth. I got about 6 left on the bottom. All my top ones have been removed. That's a denture. But I've had infections go into my brain, infections go into my heart. My teeth are just terrible. So I'm going to need to get all of those removed in order to keep myself from possibly being in an infection, abscess needing an antibiotic type situation. What else? I stay dehydrated. I can't drink water. Water makes me just violent ill. I can't eat. If I try to eat 20 minutes after I put food in my body, I'm cramping so bad, I'm sweating. It hurts. I've never felt pain like that, and I've had kidney stones. I've had a child. Being tested for gastroparesis, irritable bowel, Crohn's, and ulcerative colitis. I don't know which one it is, but one of those things is probably what's going on with my stomach. Once you have mast cell activation, though, it tends to start like a pyramid in your body. I have POTS, which is where blood doesn't flow out of your heart correctly, and you get dizzy upon standing or sitting or turning around or anything. I can scroll through my phone and get so dizzy I almost pass out. I have Ehlers-Danlos, but it hasn't caused anything severe with me. It makes me very hypermobility-ish. I can do really odd things with my hands and my feet and my arms and my legs. When I had a surgery on this hand, when I shattered this finger when I was a teenager, which if you can see the scars, I've had surgery after surgery after surgery on this finger. See them? But when I had the physical therapy, they measure your hands. They measure your normalness. And it was things like this that they were just amazed by. They were like, "What are you doing? Stop doing that." And that's just normal. That's when I try to, make my hands straight. I can just do all kinds of weird shit. I can take my arms behind my back and never disconnect my hands and pull them over my head. I can't do that as much now that I'm older. But as a kid, I did it a lot to freak people out. I used to do it in cheerleading. But that's all that I've noticed from Ehlers-Danlos is that it causes hypermobilities, hyperflexed, whatever. But they all seem to go hand in hand. Most people that have mast cell problems also have heart problems, also have digestive problems, also have migraines, which I have. I've had allergic reactions my entire life to every type of birth control I've ever put in my body. I had an IUD migrate into my chest. I had I required surgery damn near to get that Nexplanon crap out of my arm. That thing gave me migraines for 4 months straight, to the point where I couldn't even go outside because of the sunlight. I had a surgery on that finger I showed you when I was a teenager, and my body went through systemic absorption, threw me into a grand mal seizure, and I had to be on life support for 3 days because of it. And I wasn't even supposed to have been put out for that surgery. It was supposed to just been a local. So now that I know the symptoms, I can see where earlier in my life I've always had these problems. I've just never put them all together. I've never had a doctor that cared enough to put them all together, because I did also have a drug problem. And once you've gone through being an addict, doctors never look at you like you're telling the truth. It doesn't matter what you say. It's always going to be part of your addictive nature that is the reason. But anyway, I feel like crap today. I don't know if you can hear it in my voice. My anxiety is insane. Can you see me shaking? My boyfriend made a comment on Facebook yesterday about how his life is boring, and it's just ripped a hole through me, thinking that I'm the one that's causing him to feel that way. And if I ask, he won't tell me. So, anyway. One of my doctors suggested I start a video journal. I don't have enough storage on my phone to do that. So, YouTube it is. So if you want to follow me, I appreciate it. You don't have to. It's just, this is my journal. All I'm going to be doing is complaining about how I feel. So anyway, thanks for listening, and I'll be back tomorrow. Bye.